say the Premier won't back down.
On leur offre une augmentation de 11%. Ça donne 600 000 $ par année. Moi, je pense que c'est suffisant. Je pense que les Québécois sont d'accord avec ça.
These are not the right numbers, and I think the Premier knows that. We gave them a study that clearly says that Quebec specialists are underpaid compared to other provinces.
The federation representing medical specialists accuses the government, and especially the Premier, of stalling the negotiations for a new agreement that have been dragging on for the last couple of years. It says it will increase its pressure tactics, but it promises it won't affect patients' care.
We have a Premier in front of us, and he's the one who's in charge now. So we want to come to an agreement with him.
The CAQ has promised for many years a health reform that would give better services to Quebecers. On one hand, you have these negotiations that are dragging on between the medical specialists and the government. On the other hand, the CAQ has reached an agreement with GPs, but several questions remain on the actual improvements of patients' access to healthcare.
Le projet de loi numéro 19 est donc adopté.
It comes as Bill 19 was adopted in complete silence without the usual applause at the National Assembly. This law replaces the special law on doctors, the controversial Bill 2, that was adopted under closure last fall. In the following months, 500,000 patients should be under the care of a family medicine group. Of them, 180,000 will be classified as vulnerable patients and should eventually get a family doctor. If these targets are reached, GPs will receive bonuses. The former health minister Christian Dubé voted against Bill 19. Premier François Legault and his health minister Sonia Bélanger were absent when the vote took place. Key members of a government should be there when an important bill is adopted, especially on health. That will give ammunition to opposition parties to say that Legault's health reform is a failure and that the CAQ isn't effective at governing anymore.